That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdulaziz Al Khayyat.
And I'm your co-host, Dr. Bassam Al-Mullah.
And it still feels weird having you join in the second part of that
Why?
intro.
Aren't you used to it by now?
No, not at all.
I'm used to it.
Ah, okay. He's made himself
I'm
feel
becoming cameragenic.
Cameragenic. Hello. Okay, I like it. So, before we get into today's topic, what are we drinking, my son?
I don't know, you got this coffee for me. What is this?
HMC, His Majesty the Coffee.
Nice.
It's Ultimate Delgado. It's really good. Yeah. It's keeping me caffeinated today. Today I got a cappuccino, and for Bassam I got an Americano.
Did you? I thought it was a flat white.
Drink it and find out.
I can't tell the difference.
Ah, okay.
I'm not that much of a coffee person, although I'm starting to like it more
Did
now.
you actually just say that you're not a coffee person and you're the co-host of the Doctor's Brew?
I am trying to get into it. You have to give me time.
I apologize for my co-host. I really do. So, are we ready to get fired?
Why?
Why?
Listen, you'll struggle to find a replacement.
I'm talking about myself here.
Oh, you want to get fired?
Oh, with today's topic, yeah.
Ooh, we're having an interesting topic today. What is it? Tell me. Tell us.
So, today we're going to dive into the role of race, ethnicity within healthcare and medical practice. Kind of a touchy subject, something we sometimes don't want to confront or talk about, but I think it's very important for us to talk about, and it's something that I've actually been asked about. Recently, I did some stuff with Kuwait Times, which was really cool and fun.
Okay, tell us about the Kuwait Times thing. What did you do?
Oh well, we did a few videos, some reels, talking about some common questions. We are going to do a myth debunking series, so keep your eyes open for that with Kuwait Times. Like health myth debunking. The one that I really wanted to debunk, that I jumped in, I was just like, I want to talk about sabgha, the IV contrast, and how everyone in Kuwait is
Okay,
terrified.
yeah, everyone's always terrified of it. Yes.
Yeah. So keep your eyes peeled for that. Yeah, so that should be coming out soon. But one of the things we did talk about in our discussion was the role of kind of race with medicine and its practice. And I think when you look at the political climate of the world, and we're not going to get into politics here, but race is definitely a prominent subject within our discussions, you know? So
I agree.
it's important. Yeah.
Yeah. Race and ethnicity plays a role in everything and definitely has its role in healthcare as well, even though we try to pretend that it doesn't, or we try as much as we can to like minimize its role. But even in Kuwait, we still see its effects
Yes.
every day.
So before we get into the meat of this discussion, how about I want to just disclose something about race and healthcare. We know for a fact, research-wise, we know that the evidence shows that it does have an effect on healthcare outcomes. Do you remember in the UK the postcode lottery stuff?
No, tell me.
So the postcodes in the UK are similar to zip codes in the US, and it's basically like the code for your area, right? And the postcode lottery was kind of how different areas have different healthcare outcomes, different quality of life, different life expectancy, different quality of care, right? So people who are in more affluent areas had better care, better quality of life, better longer life, life expectancies versus other. And these had, these played into also race as well, because you have predominantly racial separations within a nation.
Yeah.
Yeah, like in terms of like distributed geographically, and we know that there is definitely effect, right? And I know that, for example, there was this. Remember in Manchester how they made a huge deal, and justified, about how a lot of dermatology conditions that we look at, for example, are based on white skin.
Yeah.
Yeah. So there's different. You have to keep your eyes peeled because certain findings in dermatology and whatever are not applicable to every race, right? Or it's less obvious. So for example, like melanoma on darker skinned people would be
Might not be as obvious or would present differently compared to white skin.
exactly. And then imagine, like, just because you have darker skin, your doctor's not picking up a life-saving diagnosis. Like a critical,
Yes.
life-threatening diagnosis.
But how does that translate here in Kuwait?
So here in Kuwait, so we know that for like off the cuff, we know that, again, just with our teaching and learning, we all need to take better steps at bearing in mind racial differences, between people and how that translates in healthcare. That's not even just Kuwait. That's everywhere, right? Fun fact. Did you know that I heard this that with cars, a lot of like car crashes and stuff like that have been tested on, for example, just men body. What are they called? The dummies, the crash dummies.
Yeah.
Yeah, they were all built for like men, right?
Okay.
They're not built for female bodies, right? So women have different outcomes in terms of like car accidents and stuff. because
Like
of
you
that.
mean by the injuries they sustain?
Yes. So that plays into your role, the whole orthopedic stuff. See?
Ah, that's
Yeah.
interesting.
Yeah.
Okay.
So now some efforts are being made against that, which is good. Yeah.
Okay, so what about race and racial issues here in Kuwait?
Okay. Well, touchy subject, but let's break it down into two. We have the doctors, right, and then we have the patients.
The patients.
I want to hear your perspective on something. On patients first. Patients.
Okay.
How do you feel about something we've seen plenty of times? Oh, I want a Kuwaiti doctor. I don't want XYZ doctor, not non-Kuwaiti doctor.
Yeah, we get a lot of that, which is something we weren't used to back in the UK. But like we always see these racial remarks. Sometimes they're very blatant and obvious. Sometimes like the person would just be like completely racist and be like, oh, I don't want this nationality to treat me.
Oh,
I don't want this nationality or that
Yes.
nationality to treat me. I want a Kuwaiti doctor. Or I want because they. Usually it's the older generation, and they think that maybe because the doctor that's providing their care is Kuwaiti, that the care will be better because they're Kuwaiti
Yeah.
and a different nationality, which is completely wrong. It has nothing
It's
to
not
do
fair,
with
in
it.
fact.
Yeah, it has nothing to do with it.
Yeah.
And at the end of the day, quality of care should be equal.
Yes.
It doesn't matter what nationality the doctor is and what nationality the patient is. The quality of care being provided to the patient by the doctor should be equal in both from both sides.
On that note, one thing that I wish people would just bear in mind is that everyone went to medical school, and medical school is medical school. It's not, different. We all know how to be safe doctors. They all have their qualifications. So it's not fair to judge them based off race. I will throw some sympathy, like some empathy about this issue. I guess there is an element of people want to feel like they're being cared for in their vulnerable moments by someone who can relate to them culturally.
Yeah.
I can empathize with that. But we need to also be aware that's not always available, If someone is caring for a whole ward and they don't happen to be Kuwaiti and there's no other doctor, it just...
And
is
we
what
have
it
to
is.
be aware that the reality of the situation is in Kuwait that a lot of the doctors that are here in Kuwait are not Kuwaiti.
Correct.
Majority of the hospitals, most of the doctors are not Kuwaiti.
Correct.
I think if we look at statistics, we might find that the minority are actually Kuwaiti
Yeah.
compared to all other nationalities. So we need to be accepting the fact that these different nationalities are there.
Yes.
And the patients, as well as doctors, they need to be aware of this and they need to be accepting of this because at the end of the day, we follow guidelines and the guidelines don't change based on nationality. So that shouldn't matter.
And let's also remember the history of medicine in Kuwait. What was, if I'm not mistaken, if I'm wrong about any of this, is to my knowledge, correct me if I'm wrong. What was the first hospital in Kuwait? The first formal hospital in Kuwait?
I don't know.
The,
Is it Amiri?
the Americani Hospital, which is now a museum, right?
Really?
Which was formed by, I believe they were American missionaries. It's out, I think, by Sharg, that area.
Okay, so it's a museum now.
It's a museum now. No, and they have also like it's a museum with other stuff as well. Super cool. I really recommend it. And so our healthcare system is very new. We're babies healthcare wise, right? And it was founded and built by people who were not Kuwaiti. And now we're coming in to carry the mantle. That's why you'll notice that there's a lot of young doctors who are Kuwaiti. And so you're going to see a shift for sure, I think, in the coming years.
Yeah, definitely. I think because now with every new generation of doctors that's coming every year, we're getting more and more Kuwaiti doctors compared to before.
Yeah.
and that translates to like because of scholarships, because of awareness and education, and that's increasing. So we are seeing a shift, but that doesn't mean that we should be neglecting or saying that non-Kuwaiti doctors or non-Kuwaiti patients are some people that we shouldn't be dealing with
Yeah.
here in healthcare in Kuwait.
And it sometimes does translate. I've seen cases of like, at least thankfully it hasn't been more than this, but verbal abuse. I've seen it.
Yeah.
You know.
It's as I said earlier. Sometimes it's very obvious, very blatant. Like the patient would say to the doctor themselves, like, "I don't want to be treated by a Kuwaiti doctor," or they're just being racist towards them because they're not Kuwaiti. And sometimes it's a bit more subtle here and there, but you see it. You see it on an everyday basis, and it's something that you're not used to.
Yeah.
But it's something you try to mitigate. So my question to you is, what's your response in a situation like this, when sometimes like you hear a patient telling you, "I don't want this doctor to be treating me, he's not Kuwaiti," etc., something like that?
Well, when someone tells me something flatly like I don't want this doctor to be treating me because they're not Kuwaiti, I'll just respectfully say that I'm sorry, but that's not the way it works here. Flatly, I don't need to be rude. I don't need to put someone down for
Yeah.
it, but that's not how it works. And I'm sorry, but these are the doctors we have available. Now, it's different when they tell me things like I prefer a male or female doctor, because sometimes it gets a bit intimate, you know, especially with things that have to do with sexual or reproductive health. This is where I can be a bit more sensitive, and even then
Yeah.
there's constraints. Like, I'm sorry, someone is going into labor and the only available OB doctor is a male.
He's a male doctor.
I can't exactly, you know, get the male trainee,
Yeah,
female
we've
trainee.
we've all been in these situations. Sometimes there's not an availability of a male or female doctor when a patient prefers that. But usually the patients are understanding about that because usually it's something more of an emergency.
Correct.
Um,
Because, you know,
Yeah.
like let's flip it. Would it be fair for me to be like, no, I don't want to treat this patient because they are Kuwaiti or non-Kuwaiti? That's not fair.
That's not. And usually we don't, as doctors, we don't differentiate between nationalities. At the end of the day, it's just medical conditions.
Correct.
And we're treating them, and the treatment we're providing shouldn't be different. And the quality of care we're providing shouldn't be different based on nationality. That shouldn't matter.
I'm very proud to say that in Kuwait, I have personally not seen a single instance of like doctor giving lower quality care
Yes.
based off someone's nationality. That's from my experience, right? And I'm very happy to say that. I think the main thing that we need to take away from the role of race with healthcare is we need to be aware of its implications as doctors. Like I said about how when we studied, we need to, just like when you read a research paper, right? You read a research paper and you have to be mindful of bias. You have to know that certain biases exist. You need to know how to see them, call them out, analyze, all that kind of stuff. The same thing exists in healthcare. You need to be aware that race has a role, and it's something that is usually below conscious attention, right? So that's why we need to be mindful of it and, you know, align ourselves to it, like what I said with darker skin, et cetera, et cetera. And so this is number one. Number two, we need to call out any behavior that would not,
Definitely.
you know. And a third thing that I think is also important to mention, because something that I didn't know, and it's important for us to talk about, is how there are certain medications in Kuwait, like in healthcare. Some are available for Kuwaiti nationals, and some are not available to Kuwaiti nationals. Now, the reason why I say it's important to mention this is because if you're aware of what's in the system, you can be able to help tailor and care for your patients more efficiently or better. You know what I mean? So like if you just have a limited arsenal of, I can only treat with these antihypertensives, and then you don't bear in mind that some may not be available, that's not necessarily a good thing.
Yeah.
Yeah.
But another important thing is that usually these medications, they're not critical emergency medications.
Yes.
Those are usually available for everyone, and a few of these medications, based on the Ministry of Health's availability and budget and those types of issues, those are the ones that maybe they have a certain amount limited, and they would keep those for Kuwaiti citizens. But usually those are non-essential medications.
Yes.
They're not something that, I would need to give this to save a life.
And also, not to mention that it doesn't stop them from actually buying the medicine. We're talking about what's available in the government issued
exactly.
pharmacies. So that's another thing. This is where, again, you need to employ your skills as a doctor to negotiate with the patient. Let's say they are used to medication that is not available in the government hospital. You can offer them, hey, I can write you a prescription, an outside prescription to go and buy this medicine. There's nothing wrong with that.
Yeah.
And so this is where it's like, bearing it in mind is helping your care.
And we usually, even there's lots of medication that usually is not available and provided by the government, or it ran out.
Oh,
Hospitals run out
that's
of
a
medication a
huge
lot.
thing, yeah.
That happens. That's just part of healthcare. So even to Kuwaiti patients, when we're like discharging patients, or when they're in the outpatient clinic,
Yes.
we just tell them this medication isn't available currently, but we just give them an outside prescription. They can just go buy it privately from any pharmacy or any other private hospital. That's something they can do.
And let's also take pride in one important point, is that regardless of what happens to you in Kuwait, whether you're a Kuwaiti, non-Kuwaiti, anything, something happens to you, you can go and be seen by a hospital, you could be taken by an ambulance, all of this.
Exactly.
Regardless of insurance, status, money. I know that there is a fee payment, that is available, but it's,
Compared to
Compared to
different
other
countries and things like insurance and things like that, we have to be thankful and grateful that here almost everyone will be seen immediately,
Correct.
all the time, and free healthcare is available no matter what for any emergency.
And there are charities that exist that can cover people's health expenses in Kuwait if they can't cover it. So, if you're watching this episode and you feel strongly about these issues, I really encourage you guys, find those charities out in Kuwait, donate to them, and help support someone in need.
Yeah.
Now, I think we've covered most of the stuff that I really wanted to talk about. I think this is really important, and I think we navigated this in the best way without getting fired. Great job.
Please, Ministry of Health, don't fire us. We're trying our best. We're just trying to raise awareness.
I wasn't expecting you to go so explicit into the camera.
It's okay.
I want to ask you something,
Okay.
because I can relate to you on this, okay? When we're both demigods, we're both half-bloods.
Okay.
We're Kuwaiti mixed with something else, right? Does it ever hit you, or do you ever get impacted by when someone says things like, I don't want to be treated by someone who's non-Kuwaiti, things like, I don't know. Does a part of you ever get impacted with that?
That's a hard question because I'm biased.
Okay.
I'm
go
biased
for it.
because I'm mixed. So naturally, I would immediately get bothered by that question.
Yeah.
I don't know if I would be as bothered or if I'd be the same level, to be honest. I would like to say that it wouldn't matter for me and I would still be like bothered by the question, or like I wouldn't like someone to say that,
Yeah.
because I don't think it matters, to be honest.
Correct.
It doesn't change anything. It doesn't matter what nationality is treating you. There should be a minimum standard for a doctor to provide safe healthcare and make sure the patient's okay, regardless of what the doctor's nationality is or what the patient's nationality is.
Yeah.
That none of that matters. Ethnicity and race shouldn't matter. Healthcare should be global and equal for everyone.
I agree. To be honest, for me, I'm like you. I personally, I get impacted sometimes. I do get impacted because, just like how if I was in, I don't know, if I was anywhere and they said I don't want you to treat me because you're Kuwaiti, that's still 50% of me, So the other 50% is saying, hey, come on, what's up? So yeah, it is something that impacts me, and for all fellow demigods out there, for all the fellow Kuwaiti hybrids that are doctors, we're with you in this, and we feel you when you have these struggles on the ward. We're all in this together.
Yep.
Now we break out into song and dance. Should we close it off with a question?
Yes, we'll do our question of the day. Do you have a question?
Yes, I do.
Actually, you know what? I have a question for you. Ignore the question. We'll do this one next week. I have a question for you. Since,
Hold
I'm
on.
trying to get more into coffee and things like that.
Okay.
And you're a coffee expert. So my question...
Self-proclaimed. Not actual, but self-proclaimed.
Self-proclaimed. Okay, my question is, if coffee didn't exist, what would be your alternative to, like, give yourself energy, etc., stuff like that? What's the replacement of coffee if coffee didn't
That's
exist in the
difficult.
world?
That's difficult. Okay, I'll tell you what it is. So, for me, what is coffee? For me, coffee is like a moment, right? It's very,
It's about to get romantic,
Oh,
clearly.
yeah. It's a hitting a pause for the day. You just
Okay.
take a moment to just everything. I sometimes when I drink my coffee, I just put my phone on do not disturb. I don't like it's 5 minutes. Don't speak to me. I just want to sit and just vibe for a second, right?
Okay.
So I would need something that would do that. Okay.
So let's say another hot drink. Would that do that?
Yes, but the problem is it's less accessible. So I'll tell you the closest thing for me is whenever you make like tea, not tea bag, not the boiled water and then the stupid bag. No, talking about like you have a little bit of cold fahm and so put some tea next to it and you're just sitting there letting it brew up and you pour yourself. Like that would be my closest alternative, but I don't know how convenient or available that would be. Because I don't
It's
like
a good
tea
answer.
bags.
It's a good answer. I'll accept it. I'll accept it.
What
I'll
about
take
you?
it. Me, I'm trying to look. Before, I used to like not appreciate what you were saying.
Okay.
But as I'm getting older, I noticed that.
Grandpa vibes.
Yeah, exactly. I noticed that this moment you're talking about, because I had it this morning.
Okay.
I had a cup of coffee this morning, and it was outside, and the weather was nice.
Nice.
And I like appreciated it.
Okay.
It was nice. So I'm trying to. I'm getting to appreciate this moment you're talking about more. Like coffee is not just a drink to boost your energy.
Yes.
But usually with like hectic, busy life, sometimes you don't have that opportunity. But for me, I still didn't get to your level of grandpa vibes.
Yeah.
So I would just usually coffee for me now is just an energy boost.
Okay.
So to replace it, I'll just take whatever energy boost alternative
Pre-workout?
there is. Pre-workout, energy drink, anything.
Not very good doctor advice there, huh?
Why? Pre-workout's okay. It's not healthy, but
We're
it's okay.
You know what? This is
not
gonna be
the
an
ones I take.
This is gonna be an episode topic.
Maybe next time.
Maybe next time. Well, that's the last sip of coffee for today. Thank you to my co-host for joining me for this cup of coffee.
I really enjoyed it. Thank you for having me. Technically, you're not having me anymore. We're just part of this now together.
We're all in this. Come on, High School Musical, guys.
Why do you have to make it
let's call
awkward?
it- let's call
It
it.
was good. It was okay. Okay, guys.
call it.
We'll see you next week. Thank you for tuning in.
Yeah.
Make sure you drop in your questions for next week. And
Stay tuned.
yep.
Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.